So, dear friends, we are discussing regarding the last concluding chapter regarding the case taking, that is examination of the patient, the chapter number 26, and half of the chapter we have finished in yesterday's lecture. And he has given one hint that you should not mix together the totality of acute and chronic. While treating the acute, you must find it out acute remedy which matches to that pace and prescribe for that. If it is a chronic case, your remedy should be chronic enough to tackle that chronic course and it can be cured. So, if you mix together the symptomatology of acute with the chronic, you will be lead to the confusion and that prescription never works for the patient. These concepts should be very clear. And that he tried to explain over there in detail. He has given examples of also the miasms. If there are two miasms are lurking in one patient or it is a double complex disease, then you must find it out which is the troubling the patient, which is dominant, find it out a remedy for that specific state, for that specific miasm, treat with that. After that, retake the whole case, find it out what is remaining, and then find it out another remedy. So these things, these concepts are very clear in Hahnemann's mind, and one should be cleared about it. So that while prescribing the remedy, one should not have a confusion in their mind. And that's what he tried to explain over there. Let us go ahead, and today we're going to finish this chapter so that whole case taking process will be finished. These sequelae, regardless of the disease, which stirs them up, are sorry and crop out as weakest time, which is the convalescent period. The better the acute disease is treated, less like there are to be any sequelae. If measles and scarlet fever are treated properly, we have very little trouble afterwards. Sequelae should always be charged up to the great extent to the physician. Of course, we will find now and then some constitution extremely sorry, almost in a condition of advanced decay, or and for malignant scarlet fever. In such patients, it is difficult to find a proper remedy. And then the very best physician in the world may make a mistake. Yet with good treatment in ordinary cases, you should not expect sequelae such as sore throat, running ears, etc. It is of the greatest importance in such cases to be able to separate and distinguish one thing from another so that you may know what you are prescribing for. See, very clear regarding thoughts. You should not jumble between the acute states and chronic states. If the patient is presenting to you with some acute problem, whether it may be malignancy, whether it may be any damn thing, and that is of a recent origin, then you must take that totality as separate totality. Find it out a remedy for that totality, give it to the patient, which will going to work properly. But secondly, if you mix it together with the chronic one, then it will create a problem. If the patient was suffering from some chronic disease since long time, then you take, if you want to treat that, after the acute has been covered completely, then you deal with that chronic in a proper manner. That acute remedy will not going to cure your patient, or that acute remedy will not going to work for chronic. You will require a remedy of that phase, of that depth, and then that will be settled with chronic remedy. So there is a big difference between acute and chronic remedies. We should, when we read Materia Medica, we should develop that understanding. The understanding the action of remedy, the pace of the remedy, the depth of the remedy, all things matters. Then you will be very clear about the concepts of remedies. And in order to understand this, you have to read again and again the remedy. Then you grasp the things. It is not with first reading you're going to get the depth of the remedy. Not at all. It takes long time to get. And this is what he tried to explain over there, that whenever you are dealing with such types of cases, it is necessary to understand the depth of the remedy. And one should not intermingle the acute and chronic. You cannot prescribe an antisoric in order to prevent sequelae following scarlet fever while the scarlet fever prevails. Prescribe first for the acute attack and the symptoms that belongs to it. See, very clearly he mentioned if there are if there is scarlet fever as an acute, then you find it out a remedy for that scarlet fever first. You should not mix together the two sets of symptoms. It is well, however, for the physician to know all symptoms that the patient has of chronic care, that he may know what to expect, that he may look at the close of acute attack for coming out of the old manifestations of SORA, although often an entirely new group of symptoms will appear. When at the close of scarlet fever comes troubles comes about the ears or dropsical conditions come on. These are not a part of scarlet fever itself, but the state of economy. So he is explaining over there, if you are treating a chronic disorder and then patient develop a scarlet fever, find it out, present totality, find the remedy for scarlet fever, give it to that patient. Because you have to treat that with a separate remedy which has that base. So this is very important thing which he is explaining. In my practice, I used to observe that if you get a proper remedy for acute state, then automatically you will get the next prescription very nicely. In chronic also it helps. Many times you get clear idea about the chronic states, and then you can find it out a right remedy for the chronic state also. So if you are able to catch the acute state properly, then it automatically opens up the road to find it out a chronic state also. And that's what he is explaining. The dropsical condition or acute Bright's disease must be associated with psoric state, and symptoms then will lead you to the constitutional remedy. If you have in view simply the Bright's disease, you will make a mistake. You will fall into prescribing for ultimates if you have but the name of the trouble in the mind. For instance, giving a piece which the book says is a wonderful remedy for Bright's disease following the scarlet fever. What he is explaining, if that patient has a Bright's disease later, you should not go with the name of the disease. You find it out what are the patient's symptoms, what they demand for, which remedy they demand, and then your work will be done. You should not make prescription on the basis of name of the disease. And this one should clear in their mind. I will give one simple example. If you are treating a patient with acid peptic trouble and who had a SORA in background, his disorder, chronic eczema was there, and all of a sudden patient comes to you with acute manifestation. That eczema which you are treating doesn't have clear symptoms, and that's why it becomes one-sided. But luckily enough, you get a clear-cut idea that acute state comes, and for that acute state, Naxomica is the remedy. You have prescribed the Naxomica, and after Naxomica, his acute state has been covered, but now it opens up the road for you. Now that eczema which was not clear enough, now it has come into a role, and now that eczema has typical features. It has a itching followed by scratching. The patient scratches until it bleeds, then it is followed by burning, and then patient feels better by keeping cold water or it is in cold water. So that has opened the road. That eczema which doesn't have a symptom now have a symptom, and you get the remedy. The complementary to the Naxomica is sulfur. It opens up the road to the right remedy. If the patient who is suffering from severe acid trouble and it is since chronic time, and you are treating that he gets the organ sensation, but nothing more than that you have obtained in that case, and this patient now suddenly comes to you in acute state of Naxomica, severe acid peptic trouble after eating spices, and he goes on taking out the vomiting, and then he feels better, associated with headache, associated with irritability, associated with sensitivity. All those things are present. And Then you prescribe Naxomica. And after giving the Naxomica, patient comes to you and who is having very typical features of the now sepia, which is again a complementary to the Naxomica. See, during an acute attack, the chronic disease becomes clear in its manifestations later, and then it becomes rather simple to prescribe the remedy. And all those things which we have to learn. And for that purpose, it is necessary to go through the remedy relationship again and again so that we can understand many things regarding the remedy. There are three complementaries for Naxomica. From psoric point of view, it is Sora. From tubercular point of view, it is Sepia. From psychotic point of view, it is Kali Carbonicum. So three complementaries are mentioned. And it depends. Many times you get those directions while prescribing. Then he says in next paragraph, it is a great mistake for anyone to fit remedies for the complaints or states. It is a fatal error for the physician to go to the bedside of the patient and feeling in his mind that he has had cases similar to this one and thinking this in the last case I gave so and so, therefore I will give it to this one. The physician must get such things entirely out of his mind. It is a common feature amongst the oculists who profess to be homeopathy to say, I cured such and such case with such and such remedy. I will now give this patient the same remedy. I had many times met physician in consultation who said, I had another patient, Mr. X or Mr. Z, who had similar state of affairs, just such a disease as this, and I gave him so and so, but it does not work in this case. And this is because your mind becomes prejudiced. Actually, one should be unprejudiced observer. But if you become prejudiced, you prescribe same remedy which you have used for similar type of diagnosis, and you make the mistake. Actually, you should not go with the names of the diseases. That's the big mistake which we used to do. So whenever patient comes, doctor, I am having SLE, I say, keep that SLE aside. Tell me what is your problem. So when patient tells you a diagnosis, always ask him, forget about diagnosis. You tell me what is your problem. What exactly you are having. Then you get the clarity in the symptomatology. And then you will get the right remedy. Otherwise, you become unprejudiced over there. Aphorism 100. With regard to search after the totality of the symptoms in epidemic and sporadic cases, it is only indifferent whether anything similar ever existed before in the world or not under any name whatever. Keep that in your mind. Underscore it half a dozen times with red ink. Paint it on the wall. Put an index finger to it. One of the most important things is to keep out of mind in the examination of case some other case that has have appeared to be similar. If this is not done, the mind will prejudice in spite of your best endeavor. I have to fight that with every fresh case I come to. I have to labor to keep myself from thinking about things I have cured like that before because it would prejudice my mind. And this is the thing which happens very commonly. We get prejudiced very easily. If you treat one case of cancer, you get prejudiced with the remedy. And then for similar type of cancer, you think about same remedy. But presentation might be very, for one patient of CA stomach, you might require acetic acid. Another patient, you might require Candirango. Third patient, you might require cholestyrinum. Fourth patient, you might require ornithogalum. It varies. Because once you find it out totality, then it becomes simple. Once you find it out diagnosis, then you become prejudiced. So naming the disease always creates a problem for you. And that's why Hahnemann explains over there, don't get prejudiced with the names of the disease. The purpose of all this is that you will go away and examine the patient with an unprejudiced mind, and that you will consider only the case before you, that you will have nothing in mind that will distract your attention, that you may not think of things that preceded it and find out among them a remedy while examining the patient. If you are biased in your judgment and examine patient towards certain remedy, in many instances, this will prove to be better. Have no remedy in mind until you have everything that you can get on paper. Have it all written down carefully, and then, if upon examining it in relation to the remedy, you are unable to distinguish between three or four, between three and four. You can go back and re-examine the patient with reference to those three or four remedies. So what he is explaining? He is explaining you the key that how to become unprejudiced and what one should do. Simple way is forget the name of the disease. If you want to become unprejudiced, forget the name of the disease. That is a big thing you have to develop in your. Don't consider I have treated leukemia, I have treated liver cirrhosis, I have treated fatty degeneration, I have treated so and so. If you consider like that, you become prejudiced. Then simple thing is that when patient tells you diagnosis, tell him directly. Don't tell me diagnosis. Tell me what is your problem and from what you are suffering. If you know that, then you never become unprejudiced. And once you never become unprejudiced, then it become your work is half done. And then he explains to conclude the chapter, big paragraph. This is the only possible time you can try to fit a remedy or image a remedy while examining it. Get all symptoms first and then commence your analysis in relation to the remedy. The analysis of sickness is for purpose of gathering together that about it which is peculiar. For peculiar things relate to the remedy. Sickness have in them that which is peculiar, strange, and rare, and the things in sickness that may be wondered at are the things to be compared with those in the remedy that are peculiar. Now, in order to see that which is wonderful and strange, it is necessary for you to have much knowledge of disease and much knowledge of metabology, not so much in an extensive knowledge of morbid anatomy, but knowledge of symptoms or language that disease expresses itself in. So to become unprejudiced, this is one more key which is explaining that you must have a thorough knowledge about the language of the disease, the what the patient presents. Don't go with the labeling the disease. Yes, I have treated lymphosarcoma of the intestine. No need. Just find it out what the patient has presented, what patient experienced. Patient comes severe burning in stomach, when in abdomen, he cannot eat. Whenever he eats, he starts getting the pain. And he's a diagnosed case of CL stomach, and patient tells you, doctor, there is a vomiting. Many times it contains blood. And then he says, whenever pain starts, I used to lie on abdomen, and that is the only position in which I feel better. And patient is absolutely debilitated, weak, sit and lying down. And he says that, doctor, please do something. I'm not able to sit. I have to lie down on my abdomen, on my tummy. Then your remedy never depends upon cancer of stomach. Your remedy depends upon symptomatology. Then you think it is acetic acid, and then you prescribe and you get the results. So these are things which you have to catch. Rewards gets only when you go with the symptoms. Once you go with the diagnosis, you never get the rewards. This is the thing which I explain. In fact, we ought to regard the pure image of each prevailing disease as a thing that is new and unknown, and study the same from its foundation. If we would really exercise the art of healing, a great deal depends upon physician's ability to perceive what constitutes the miasm. If he is dull of prescription, he will intermingle symptoms that do not belong together. So this is one more thing that you must have thorough knowledge of miasm. If your concepts about miasms are clear in your mind, then your prescription is rather simple. You must make this habit of understanding the miasm, the depth. So your remedy will be very perfect. My suggestion to learn the miasm, open the playlist in the YouTube, first aphorism. I think there are many lectures on first aphorism where I have explained in detail the miasms. Go through that, understand that miasm. And once miasms concepts are clear, then it becomes rather simple task to find it out right remedy. Then you will never mix up the symptomatology. Animal seems to have had most wonderful perception. He seems to see at a glance. Animal was skillful in his respect because he was hard student of mathematics and because he proved his mathematics daily. This was very simple for Hahnemann because he was a hard student of mathematics. He has proved 99 remedies in his lifetime, because of which he was very clear with the concept what this remedy will going to produce. His thoughts were very clear. He had examined the remedies carefully. We saw them and he felt them. He realized them. We ought never to substitute hypothesis in the room of the observation. Never regard any case as already known. Now we see why it is that it does not make any difference with the physician whether he has seen such diseases before or not. The homeopathic physician is acquainted with signs and symptoms of the man, and a different disease is only a change in combination of them, only a change in their manner, form, and representation. So homeopathic physician must develop a skill to get the totality, to get the symptomatology, instead of going with the names of the diseases. And if you develop this skill, then you will find the right remedy and the rewards for it. And this is what he wants to explain. To conclude this, he explains the homeopathic physician is acquainted with signs and symptoms of the man. And the different disease is only a change in combination of them, only a change in the order, perfect order, in every sickness that present.
No voice, sir.
Hello, hello, hello,
आवाज खूप कमी येतोय सर.
hello. Just a
हॅलो
minute.
सर, आवाज खूप कमी येतोय सर.
Just a minute. Hello.
ओके सर. ओके सर. ओके.
Clear now? Okay.
येस सर. येस सर.
Yes, it is clear, sir, now.
Yep. To conclude this chapter, what he says, the homeopathic physician is acquainted with signs and symptoms of the man, and different disease is only a change of the combination of them, only a change in their manner, form, and representation. There is order, perfect order, in every sickness that presents itself, and it rests with the physician to find the order. The homeopathic physician need never to be taken unaware. So to conclude the chapter, what he says that you must go with the order. You must find it out what is happening with the patient, how it has developed. Just check the ODP, find it out what was first symptom, second symptom, third symptom, what were their what is location, sensation, modality, concomitant, what is characteristic. That guides you towards the proper remedy and not the name of the disease. If you get that properly, then you get a right remedy and then you get exactly the results what you desire. So the last part in the examination of the case, which he highlighted, is that don't be a prejudiced, be unprejudiced. And how to become unprejudiced is to go with the symptomatology instead of diagnosis. And once you get that, then it will be rather simple for you to become unprejudiced. And this is the work you have to do. So we have to finish those chapters related with the examination of the patient clearly, right from 22, chapter number 22 to 26. So big chapters where we have finished. One more chapter, next one, 27, will start after the Diwali holidays. I will let you know when we're going to start lectures again. From tomorrow, there will be a holiday. Most probably for a week, we'll have holidays. I will let you know exactly when we're going to restart. And even Materia Medica session, today it is not possible for me to conduct. So Materia Medica session also will be started after the holidays. So we'll meet after the Diwali festival. So very good, happy Diwali to all of you, and a very prosperous New Year. My best wishes to
Happy
all.
Diwali sir. To you.
Yes, and thanks a lot. Any queries
Yes,
there?
sir.
We'll have a discussion. Otherwise, we'll conclude. So today there will be no session on Materia Medica. We'll meet after Diwali. Okay. Good night and have a nice.
Thank you, sir. Good night.